Good day, class. In this video, we are going to study amenorrhea. From the definition, amenorrhea refers to the absence of menarche in ladies who are older the age of 16, or the absence of menstruation for 3 consecutive months, which means the amenorrhea in acupuncture. In this session, we focus on the functional amenorrhea. In other words, there is no physical damage to the female reproductive system. In the other situation, such as the ladies during pregnancy, during breastfeeding or menopause, and in the other situation, that the ladies, they start period within 1 month. So from menarche, within 1 year. The lady may present with abnormal menstruation, especially in terms of the frequency. And these persons, they don't have any symptoms or any discomfort. In this situation, we do not consider as amenorrhea. Amenorrhea in conventional medicine, sometimes it is not considered as an independent disease, but rather a symptom. In the classical texts, there are many discussions with regard to the amenorrhea. For example, in 黄帝内经, you already described that amenorrhea may be due to kidney deficiency. It may be due to in 伤寒杂病论, the author described that it may due to the deficiency, may due to the cold accumulation, or the stagnation. More specifically, qi stagnation. And then the other authors also emphasize that the amenorrhea is due to the damage or dysfunction of Ren and Chong meridian. You will see from dysmenorrhea and amenorrhea, actually anything related to menstruation, we always talk about the Chong meridian, the Ren meridian. The reason is because the Chong meridian is the sea of the blood. The Ren meridian is the sea of the yin meridians. Menstruation, the physical blood, this is yin. That's why the yin meridian, the Ren meridian, is very important to menstruation. In the other text, other authors also mentions the other possible causes for amenorrhea, such as the blood deficiency. The blood deficiency is the physical symptom or physical manifestation of amenorrhea. So there's no blood, and with no blood, we need to think about the cause that's underlying behind the lack of blood, which means especially the kidney. So the amenorrhea is very closely related to the kidney, the Chong meridian, the Ren meridian, and the uterus itself. When we talk about the pathogenesis, similar to dysmenorrhea, it's either excess or deficient. Excess, it can be the stagnation. The stagnation can be qi stagnation, blastasis. It also can be the phlegm and dampness accumulation. All these will result in the blockage of Ren and Du meridian, which will further result in amenorrhea. Apart from the excess syndrome, it also may due to deficiency. More specifically, the liver deficiency and kidney deficiency. The reason is because the liver stores the blood. The kidney is the source of innate essence. And also, the menstruation is directly related to the kidney itself. This is also linked to the reproductive system. The reproductive system related to the kidney. So that's why kidney deficiency or exomes deficiency may result in amenorrhea. When we diagnose amenorrhea, we must collect the information on the previous menstruation, such as the age of menarche, the duration of the cycle from this month to next month, how many days, the duration of the period or the bleeding period, normally will be 5 to 7 days, the volume of the blood, the color of the blood, and the property of the blood, any clots. So all these symptoms and signs can help us to diagnose, especially to differentiate different symptoms. Apart from these, the post-menstruation situation, we also need to think about other possible causes that may result in amenorrhea, such as the emotion problems, stress, the sudden change of environments, or some medication. Some medication, including the hormones, the female hormones, for to prevent pregnancy. The other very common situation is losing weight. So in some situation, ladies they try to lose weight, and then achieve certain level. When they lose weight, when they become very skinny, and then all of a sudden there's no period, become amenorrhea. The reason is because once the lady becomes too skinny, and this is due to the lack of qi and blood in the body, and then it will further result in lack of menstruation that presents as amenorrhea. In the other situation, we also need to clarify from the patient is, has the patient done any surgery that's related to uterus or any other possible diseases? Amenorrhea is commonly happens in girls when they start the menstruation within 1 year, and also very common happens in pregnancy. But pregnancy is not considered as disease. There's one situation that we need to think about is the problem with the fetus. So there is some problem with the baby, and then in the meantime the patient presents with amenorrhea. In this situation, the lady may present with abdominal pain and poor appetite, nausea, or vomiting. So for this situation, you must refer the patient to see their gynaecist. The last common situation will be pregnancy and also the menopause. So patients around the age of 50 during the period of menopause also may present with amenorrhea. The treatments for amenorrhea, there are two principles. For deficiency, we're going to tonify. For excess, we're going to activate the circulation. And then for the combination of deficiency and excess, we're going to use the combination treatments of tonify and activation. Which means from the treatment principles, you will already understand that the symptoms of amenorrhea that will mostly be categorized in two symptoms, excess or deficiency. For deficiency, there are some common symptoms. The girls may have their menarche after the age of 16, or the menstruation already started, but there's less volume, pale color, or light red color. less volume, light red color. And also you can consider the development or the body developments, such as the height. And the weak body constitution. These are all can indicate the deficiency. The other deficiency, the patient may present with weakness in the lower back or weakness in the knees. This can indicate the kidney deficiency. The patient also may present a blurred vision, the feverish sensation in the palms and soles. As you can see, this is the second syndrome, liver and kidney insufficiency. The patient also may present as coldness, aversion to cold, coldness in extremities, pale tongue, and weak pulse. These are considered as deficiency. So from the symptoms, you can categorize them into excess and deficiency. And furthermore, you can try to distinguish from which pathogen, such as the blood or qi, the liver or kidney. And then you also can categorize them into deficiency. So you can categorize it into excess or deficiency. So these are the most common situation, common symptoms of amenorrhea. Similar to the other diseases, for the individual symptoms, we're not going to go through one by one. So you must just try to identify the key symptoms, such as for qi stagnation. What are the key symptoms for qi stagnation? Firstly, the patient must present with something related to menstruation, amenorrhea. There is no period blood, no period. Qi stagnation, distension, foodness. These are the common symptoms for qi stagnation. Worse with pressure. This is due to the excess syndrome. So you must try to identify all these symptoms. The treatment principles will depend on the symptom, but just in general, for deficiency, you're going to tonify to nourish the blood and regulate the maturation. For excess, you're going to activate the blood circulation and manage to regulate the maturation. The points you're going to use room 4, stomach 36, stomach 29. Stomach 29 is very effective for, or it is very commonly used for anything related to menstruation. Room 4 to tonify. Stomach 36. That's on the stomach meridian. That's where the source of qi and blood comes from. That's why we use stomach 36. For qi and blood deficiency, you can add room 6. Because qi high is the C of qi. Blood 20, 21, the spleen and stomach. So this is similar to stomach 36. Just try to strengthen the function of spleen and stomach. And once the spleen and stomach function has been strengthened, the patient will have more qi and blood. The reason is because spleen and stomach, these two are the source of qi and blood. Idle fever or sweating, these are due to deficiency, indeficiency. That's why we add kidney 3. For excess syndrome, we're going to use around 3, spleen 6, and stomach 29. So the others are the points that you can add. Large intestine 4 and liver 3, these can activate the circulation. Phlegm, stomach 40, that we have emphasized for many times. Stomach 40 is very effective for clearing phlegm, no matter physical phlegm or invisible phlegm or cold. You can use these points with Moxibustion. Needle technique. For excess, you're going to use reducing. For deficiency, you're going to use reinforcing techniques. Acupuncture can be used for amenorrhea, but when we treat these patients, we must try to understand what are the causes. Is it primary amenorrhea or secondary amenorrhea? Is it due to the physical damage to organs or the functional problems? So if the patient experiences the damage to the physical organs, especially the physical organs related to the reproductive system, the results won't be good. For functional amenorrhea, then we can use acupuncture for this situation. In the meantime, apart from the treatments, what we need to advise the patient is because some situation may due to qi and blood qi stagnation or blood stasis. So apart from the treatment, we must advise the patient to have a better emotion, but how to achieve or how to be in the situation of better emotion. You can advise the patient to exercise, to maintain regular exercise. These exercise also will strengthen the body constitution, which will benefit the qi or blood deficiency, can improve the situation of qi and blood deficiency. So these are some advice that we can give the patient to remain the emotion, to activate, to exercise, to activate the liver, especially the qi stagnation or the liver qi stagnation, and to improve the body constitution. Metrorrhagia refers to the uterine bleeding at irregular intervals, particularly between the expected menstrual periods. In other words, the Metrorrhagia is a type of vaginal bleeding, a type of excess bleeding, but this bleeding may be bleeding or spotting. The treatments for this situation, the previous experts in Chinese medicine, they propose that there are three principles of the treatments. Each principles will be determined according to the time when you're going to interfere the disease. For example, at the beginning, you're going to stop the blood, you're going to stop the bleeding, so you're going to use some technique to stop the bleeding. In the afterwards, you're going to use the technique to clear the heat. The reason, as you can see from the etiology, the reason for Metrorrhagia may due to heat. So you can try to clear heat to cool the blood to stop the bleeding. This is also, you can think about the bleeding due to the heat, due to excess heat, because the heat will promote the circulation. But once you promote the circulation too much, it will result in excess bleeding. That's why we need to clear the heat in the blood to cool the blood. And then in the end, we need to tonify. When we said in the end, it more refers to the duration. So if the bleeding has been long, has been weeks or even months, and in the meantime, the patient presents with pale tongue, pale coating, pale complexion, or with teeth mark, then you can consider as qi deficiency. The qi deficiency will result in the blood deficiency as well. And the other reason is also from excess bleeding will result in blood deficiency. So in this situation, patient may present as qi and blood deficiency. So at the later stage, we're going to tonify. So the three principles will be to stop at the early stage to stop bleeding, The second is to clear the heat in the blood, to cool the blood. The third, to tonify. So these three are the principles of the treatment of Metrorrhagia. When we think about the etiology, it's more related to the spleen, the kidney, and the blood. The blood can be blood heat, spleen and kidney deficiency, or blood stasis. That's why in some treatments, for treating the Metrorrhagia, we will use activating technique. So there was one case that we with a group of students that we see in the clinic. A patient presented with Metrorrhagia, and in the treatments, I used large intestine 4 and liver 3. Although I use other points, but in the meantime, I have used these 2 points, large intestine 4 and liver 3. The reason is because large intestine 4 and liver 3 can activate the qi and blood circulation. The reason is because of blood stasis. So try to remove this patient presented with excess bleeding. Excess bleeding may result in blood stasis. So in the treatments, I'm going to activate the qi and blood circulation to remove the blood stasis. And in this way, we may try to relieve the excess bleeding. So that's how we apply the theory into practice. It depends on the symptoms. The treatment principle depends on the symptoms. For deficiency syndrome, we're going to tonify. The patient may present as excess bleeding. The color may be light. The property of the blood may be clear. Perfumes clear. Scanty can be kidney insufficiency. So it depends on the individual situation. And then for the excess syndrome, the patient may present with dark red, the heat, dampness, sticky, qi stagnation. The patient may present with blood clots and also other symptoms that are related to qi stagnation. Sighing, distending sensation. These are all very typical symptoms for qi stagnation. So for these situations, sometimes you need to remove the blood stasis to activate the qi circulation. Okay, so the treatment principles to regulate the Chong and Ren meridian. So you can use points on the Chong meridian, although we don't have points on the Chong meridian, but Chong meridian link to other meridians. So you can use the points. This is similar to the meeting points for Chong meridian and other points. You can use points on the Ren meridian. But in the meantime, what you need to do, sometimes we will choose the same points, such as Ren 6, but you will use different techniques, reinforcing or reducing. Excess syndrome, you're going to use reducing. And also try to reduce the pathogens. Row 6, spleen 6, Summer 36. For deficiency, you're going to use the reinforcing technique. Because of the amenorrhea, you don't have blood. So the deficiency, you're going to focus on the spleen and stomach. That's where the qi and blood come from. For spleen qi deficiency, you can add Du20, blood 20, blood 21. Spleen qi deficiency. In the other situation, the patient also may present as the prolapse of uterus. You also can use Du20. For kidney yang deficiency, blood 23, that's the kidney. Du4, 命门, the gates of life. That's also related to kidney, because kidney is where the innate essence stores. kidney insufficiency, kidney 2, because the kidney insufficiency may result in heat, and Xin stream points can be used for clearing heat. Kidney 3 is the yuan source point of kidney, can tonify kidney directly. Night sweat, you can use hot 6. Insomnia, hot 7. Assessment condition, UCB run 4 or even run 6, but you're going to use a reducing technique. In this video, we have discussed 2 diseases. One is the Amenorrhea, the second is the Metrorrhagia. For Amenorrhea, we must understand the definition. It must be in the lady above the age of 16. It must happen for continuous 3 months, more than continuous 3 months. And it doesn't consider as disease within 1 year after menarche or in other physiology situations such as pregnancy, breastfeeding, or menopause. For the treatments of amenorrhea, we must identify the symptoms and the excess or deficiency. For the Metrorrhagia, also very similar. For the causes, we must identify the causes, and then for the treatment principles, there are 3 treatment principles. To stop bleeding, firstly, to stop bleeding. This also can be used at the early stage of the excess bleeding, and then followed by clearing heat. Clearing heat, especially the clearing heat in the blood, so cooling the blood. For this purpose, you also can use the technique such as reducing technique, especially the comprehensive reducing technique. You also can choose some points that are related to the blood, such as spleen 10. Thirdly is to tonify qi and blood. The reason is because excess bleeding itself will result in blood deficiency. That's why in the later stage, you must think about to tonify, to use Moxibustion, to use comprehensive reinforcing technique on some points, such as run 6, run 4, and also the actual points, 子宫, 3 cun lateral to the middle line, 4 cun below the baby button. So these 2 are the actual points, 子宫, specifically for uterus. For the excess bleeding, Metrorrhagia, and for this problem, if it happens during the age of menopause, which means during the age roughly about the age of 50, if the patient experiences the irregular menstruation and Metrorrhagia comes and goes, apart from the treatment, you must advise the patient to see a gynae or prescribe the ultrasound for the patient. The reason is because we must, if the symptom comes and goes at this age, we must consider or we must exclude the possibility of cancer. Especially for extremely severe excess bleeding. So we must exclude the possibility of cancer. Thank you for your attention.